Okay, my name is Yasmeen Sajjad. I'm a consultant in obstetrician gynecologist, but I'm a subspecialist in reproductive medicine and andrology. My background training is from UK. Originally, I'm from Pakistan, but I had all my training in UK, and I've been in UK for almost now 45 years. My initial OBS&GYN training was here in the Northwest. And then I did my subspecialized training in reproductive medicine, IVF, and then again super specialized in andrology. So my background training was in Liverpool. I did my subspec training in IVF from Hewitt Center, which is one of the largest tertiary center in the UK for IVF. And then I was appointed as a consultant in St. Mary's Hospital, Manchester, which is again a tertiary center in the Northwest. And then I became the medical director of IVF Center in 2010, 11 in Manchester. And during that time, I was also a trainer for the MRCOG, and hence you see my name and my lectures in the MRCOG. I was the examiner for the Royal College UK group, and I was running lots of courses for them for the MRCOG in London. And after my subspec appointment for the IVF in Manchester, I was also examiner for the IVF specialist exam, because those who are undergoing training for 3 years, including a research, they are assessed by the Royal College every year, the candidates, and then we pass them to see whether they are deemed satisfactorily complete the training requirements of the Royal College. And following that, they are given the CCST, which is a subspecialist training in reproductive medicine. And then these candidates, they get the subspecialist training in IVF. So that's what my background is. It is very passionate about teaching, training, and the academic side. I have a very a strong interest in research. I've run a lot of randomized controlled trials in the UK. And then due to family reasons, I moved to UAE in 2016. And then 2016, since then, I led quite a few centers, two centers, big centers of IVF as a medical director in Abu Dhabi. And currently, I'm the medical director of Fakih IVF Center in Abu Dhabi. And I'm also the program director and designated institutional officer for the fellowship program in IVF, which is accredited by the Department of Health in UAE and also by the Emirati board. So I have established the first ever fellowship program in the UAE to train the candidates in IVF on the same standard as that of Europe and America. And it's a 3-year fellowship program that we have established, including research. And then by the end of this 3 years, the candidates will acquire a license to practice as a consultant in reproductive medicine in UAE. Prior to me starting this fellowship program, there was no robust training program in the Gulf. And this program that we put together is based on the American, the European standard, which is on a modular basis, and it includes full robust training, milestones, and then they have exams as exit exams at the end of the 3 years. So during these 3 years, they have publications, they have research, and now I have completed my first year. 4 candidates, they have completed their first year. They will be promoted to second year. And we are also starting 5 randomized controlled trials, which is placebo controlled in first ever in the UAE. Other than that, I have also established an embryology fellowship program, which we will be commencing from the 1st of January. And again, that is also a DOH accredited program. And the next phase will be the nurses training. So beside this, because this fellowship program is purely for people who are working in the UAE, and they have to apply through the Department of Health to get, selected, and their very selection criteria is very, very stringent. Plus, there are a number of seats are only 2 per year. And that's sort of bothly for the Emiratis and non-Emiratis. Hello. So we decided that because I have so much interest being shown by candidates from outside UAE and within UAE who does not fulfill the eligibility criteria for this fellowship exam. So I decided to set up a separate program which is on the same format but with a shorter time, and also accessible for people who are not in the country and who cannot basically afford to leave their jobs and work in UAE and for this fellowship program. So to make it easy for them, I have sort of, I will start producing some, a mastership program, diploma, and also online coaching. And this actually today is just an introduction, and I just want to know from people how they would, like to avail these different opportunities. So the first program that we're going to do will be on a weekend, which include all the online lectures from basic to more advanced. They will be online lectures, communications, interactions, case-based discussions, and also, value your feedback. And if the candidates feel they have benefited from that, then we may sort of include this on regular basis. And this the 2 day will award them with certification. And mind you, we have signed a number of contracts with different universities in the UAE, and we are planning with the UK as well. And I'm planning to get like a diploma type programs on online. The next phase will be, which hopefully in the next few months will be, that we will do like a 6 months a mastership program, which will include all the modules that I do for the 2 years fellowship, including 1 year research. And I will basically squeeze it into 6 months, a program with online lectures, and including in during these 6 months, there will be like a week or a 5 days things for the candidates to come and work, not work, but have an observership program in centers, so that they actually see all the IVF process that is happening, interact with patients, see the theater cases and all that. And this will be for those candidates who does not have a license to work in the UAE. But those candidates who have got a license in UAE, we may be able to provide them a hands-on experience in our center. So there's a lot that we will be offering, and because, as I said in the beginning, teaching, training is my passion, and I want to train people in the best possible way, so that they have a robust and structural training for their whatever future career they want to pursue. So the the restrictions that we have and the limitations that we have in UAE is the licensing. So if you don't have a license, you cannot touch patients, although you can come and observe. And I have a program that candidates are coming, doctors are coming, spending a week or 2 weeks with me, and just to observe and see what is happening on a day-to-day basis in an IVF setting. But those who have a license, then that's not a problem. We can basically give them hands-on. But I'm working on also simulators and also applying candidates to come and spend some time in an IVF center. So that's just a gist about what we are planning through the med exam platform, and we will have more and more inshallah coming through. So that's just a brief introduction about myself and what we entail. And I would like to hear from you guys. So if you can just briefly introduce yourself and tell me where you are working, what is the status of your, level of training, and what you want to sort of achieve from these. And I will take this back, and then I will compile some different program which is easy for you guys, and which can help you to learn more and more in the field of reproductive medicines whilst you're still continuing with whatever you are doing. So, okay, can I ask, I think Dr. Fatihas, can you just introduce yourself, please? Hello? It's radio silence. Anam, can you hear me?
Yeah, we can hear you. All right, so anyone who would like to start first, they can raise their hand and they can start introducing, and they would like to have any sort of advice regarding what they are working on right now and how should they start if they want to pursue with IVF. So Dr. Yasmeen is all ours today. So just shoot with the questions, please. Yeah, I guess Dr. Rabia wants to start. Anyone? Dr. Rabia, Dr. Abu Huraira, Dr.
Anybody,
Arshina.
you want to
Yeah,
ask me anything, whether it's career,
yeah.
whether it's clinical related, whether it's exam related, I'm here and I'll try to answer whatever you want to ask me.
Yes. The sole purpose of this session today is just to get an introduction and to hear from you people that what advice do you need and how much beneficial this workshop and courses will be for you. So please don't hesitate, and if you want to write in the chat box, you can write. If you want to just open the mic and speak about it, you can do that. Even if somebody wants to share the camera, they can do that. That is also permissible. So let's start.
It's better to you talk. This is not an examination, okay? So this is not your OSCE or anything. This is a very informal discussion. And I tell you, I have been uh, through really hardship, and I know how difficult for people, to get through this training, because IVF training and experience is not easy to get. But I'm all yours. And as I said to you, I did never had any mentorship. I never had sort of the opportunity. Whatever I created is all my hard work and dedication. So I want to give that to you guys, right? I'm here to help you in whichever way you want to utilize that. So please do not feel shy. Do not feel, apprehensive about anything. It's just a chat. You tell me how I can help you. You tell me what you want, what is easy for you. And MedExam and myself, we can work together and work around you, because thanks to COVID, now we can communicate on this Zoom, wherever you are in the world. So it's very, 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 very easy, and to basically give my experience and my teaching and training to you in whatever way I can. So somebody has put working as a resident in KSA, waiting for MRCPI OSCE result, interested in IVF courses. Of course, I think that will be really good. You know, the way I'm going to devise these courses would be that it does not affect your day-to-day workload. So most of these courses and sessions will be done over the weekend. I'm in UK coming on holiday because my family is here, so that's why the time difference is there. But if I'm in UAE, you guys in Pakistan or you know, wherever other Gulf countries, it's just an hour difference. So we'll make sure that it's done on the weekend so it does not affect your day-to-day working. And the program will be covering, you know, from basics to more advanced. So it will cover the infertility, it will cover the male infertility, female infertility, the genetics, and also these days is a lot about the genetics. We will do that. And we will also talk about the new innovations which are, you know, coming up, because it's a very dynamic field and it's a rapidly evolving field of medicine. And we want to be, you know, basically up to date with what the recent advances are. Okay,
Afternoon,
so
ma'am.
yeah, sure. Okay. I could not understand that, but okay. So said, thank you very much, Asma. Yes. Why don't you come back to your home country and initiate same procedure and work you have done in UAE? So coming back to my own country, Pakistan, I tried a couple of times. I tried it in Islamabad. I tried in Peshawar. But the thing is that in sorry to say, you know, it did not work because of the politics, and there were several reasons. Although yes, I gave them the options of even I can come for the weekend there, but nothing materialized. And so if yes, you can create that opportunity, Asma, I'll be more than happy to come. And with med exam, we are planning that we will be setting up some courses in Pakistan where I can come over the weekend and you know, help candidates or even patients. So Asma, if you have something, I'm all yours. I'm happy to join.
Absolutely. That's the trajectory, actually.
Okay, so Mariam said, I have joined late. Please, can you explain, ma'am, what I will benefit of these workshops and what kind of certificate I will be and prices and of course period. Okay, so Mariam, yes, I think I gave a brief introduction earlier on, and I think you missed that, but I will just reiterate it and summarize it, that you will benefit if depending on what career you pursue. If you are an OB/GYN, you're working in clinics and you're dealing with infertility cases, then these workshops that you will attend, it will give you a knowledge of how to approach patients, how to troubleshoot, and how to give them the best possible treatment in terms of evidence base. Because I don't sort of, my treatment is not mumbo jumbo. I go by scientific evidence. And whatever treatment I give, I always tell my patients why I'm doing it. As we teach you in MRCOG, whenever you're giving treatment, don't just say, I'm going to treat you. You justify. So I also justify whatever treatment I give. So in these courses, we will be telling you why certain treatment is better, why other treatment is not good. And there will be cases that we will discuss with you, what we call is challenging cases. So that's what you will benefit. Certificate wise, yes, you will get certificate of, you know, you have attended these courses. And as I said in the beginning, that we are working with some universities where we will give you diplomas. So you will get a diploma certificate from attending these courses. Regarding the prices, that's not my place to tell you. That's the med exams that you're dealing with. That's they will tell you, because money is nothing that I deal with. Even when the patients are coming for treatment and cash patient, they ask me about the packages, and I said, I'm really sorry. I usually divert them to the finance side. So I think med exam finance side will be able to help you. And the course period, as I said to you, it would be a weekend course as well. And we will be starting a 3 months and a 6 months course, depending on the interest and shown by the candidates. Because as I said to you, it's just now the last few weeks that we have started discussing it. After my this first year fellowship, they are moving to the next year, and it's a well-established fellowship program. So it gave me the confidence that yes, we can extend it to the online side as well. Okay, I hope, Miriam, that answer your question. Samina Bano, I'm working in Pakistan, gynecologist interested in IVF training. Happy to hear that I can do it online. Thank you very much, Samina. Yes, I'll be more than happy to support and help in whichever way I can. Sana, courses will be based on how many sessions, eligibility criteria, RCOG recommended, and fees detail. So to answer that question, the courses it will be on the modules that we do, and as I said, that all the modules will be covered. So the 3-year fellowship is based on 9 modules, which cover all the modules, including genetics, andrology, menopause, minimal access, and all that is based. So I will basically minimize that, and whatever we can do online, we will do that. So again, I cannot tell you how many sessions will be, or what, but I assure you that it will cover all the modules and all the areas, subspecialty fields of reproductive medicine. Eligibility criterias, I don't think so that it will be very stringent or strict. It depends if you can attend these sessions in your own time, then I think anybody can attend. It's not RCOG recommended, because RCOG is MRCOG1, and this is a subspecialty training program. But this program is based on the combination of American and European. So if you attend these courses and you have, if you apply anywhere, say in Pakistan and even in UK, and you have attended a robust program with proper modules, then yes, it will hold you higher in the selection criteria. So, for example, whenever I'm selecting a candidate for a job, whether it was in UK or UAE, I always look at what they have done, what experience they have, what sort of diplomas, certifications, and that they have. And if they have attended from a reputable organization, then of course I basically grade them a bit higher than the other candidates who has not. So of course that will give you a push in whichever selection area, or selection in the selection process, sorry. Fakih IVF is the pioneer of IVF in this country, in UAE. We have about 7 to 8 centers in UAE. We also have got a center in Doha. We have got in Oman. So it's a bigger name. And now with the Department of Health, we are also a bigger name, because I have established the academic institution with this organization. So that is where you will benefit. Okay. Regarding the fee, as I also sort of said to you, med exam will be able to give you further. So somebody has get that the seats available, and regarding IVF workshop, there is a number, you can contact them. Okay, so Shaista is saying, ma'am, I had my MSc in Human Clinical Embryology and Assisted Conception from Dundee, Sotken. Is there any job opportunity for me? I'm really sorry. This is not that we are offering a job here. This is not a job interview. This is about the training. So, of course, if there is any job comes up, you can apply. And, if you fulfill the criteria and satisfy the interviewers, then you can get the job. So good luck for that. Dr. Amna Kiran, I'm from Karachi, Pakistan. I'm really interested in IVF. It's really good to know that we can do online. Of course, that's the reason why I have started planning for online, because I can access and get this education and training to people who cannot be present on site in UAE. Rabia, thanks for the opportunity. This workshop relevant for the upcoming MRCG exam. I'm interested, but after my exam. Of course, as I said to you, the MRC, the workshop will be happening on regular basis. So whenever you are free from your MRCG, you can attend. And good luck for the MRCG exams, inshallah. Bilal, thanks for joining the session. IVF workshop features, please DM. Okay, this number. Asma, I'm from King Edward Medical University. I know government is not very interested in this kind of work. We have to do everything on our own. And after conversation with top gynecology in Lahore, we can make first IVF center, but this is outstanding. I know it's difficult, but not impossible. Of course, I fully agree with you, Asma. It's not impossible. And I tell you, now, I'm not going to take their names, but I was approached by big centers, for example, Shifa International, also Northwest in Peshawar. And because I can speak 3, 4 languages in Pakistan, so it was easy for me. But because of, I think what they wanted, what I got the feeling is that they wanted to use me to train the people and then basically bye bye. But that it doesn't work like that. I'm here to help, but I should not be used. So I have some principles and I've got some ethics, and unfortunately I would not do anything which is unethical. So I hope you understand that. But I'm here, Asma. If you want my help in whatever way, please do contact me. I did some courses in Rashid Latif in Lahore a number of times, and I had also done some courses in Islamabad. I was on about 7 years back. I was doing courses till then in Karachi as well as in Islamabad for the MRCOG. Okay. Courses details. So the link is there. Shahida Ashraf, at which licenses we can work in UAE in IVF, GP or gynecology specialist? Okay, so yes, that's an interesting question. For IVF, you cannot work as a GP. You have to have a gynecology, obstetric and gynecology license. Then you apply for IVF license. And IVF license is, again, you have to go through the criteria, and also you have to go through the exam. So I'm the Department of Health examiner for the licensing of IVF as well. So you apply to the Department of Health, then you get shortlisted. Once you're shortlisted, then we interview you, and if you fulfill the interview process, then you are offered a license of a specialist or consultant, depending on the different criteria. Okay. Hina Ashfaq, how can we apply for REI fellowship in Middle East? So this is, as I said to you in the beginning, that you apply through the Department of Health link if you are working in the UAE. And there are for Emirati, the criteria, the local Emiratis, the criteria is different compared to the expats. So if you're working in UAE and you have got the obstetric and gynecology residency completed, or you are in year 4 or year 5, and if you are expat and you are under 36 years of age, you can apply online to the Department of Health for the Reproductive Medicine Fellowship. If you're Emirati, then it's up to the age of 40. Now, once you apply, then you will be shortlisted by the DOH, and then it comes to me. Then I interview you, and if I feel that you're suitable, then I give the ranking to the Department of Health, who will select you for the REI fellowship. So currently, the only fellowship which is available is through Fakih. So I'm actually the pioneer of this establishing fellowship in the Emirates. So that's how you can do that. But I'm also starting a side-by-side online fellowship, which will be through the MedExam platform. We will do mostly online, and we will also do that you come and spend some time in the IVF center. But the problem is the licensing, and I'm working with the Department of Health that how we can bypass that, if any candidates can come from outside and do the what is it called, can do the private fellowship. Any plan for live training in Pakistan or other Gulf countries? Yes, definitely. We are working with the MedExam, and we will be bringing these live training to Pakistan and other Gulf countries as well. So I think the organization MedExam will make a note of that, and depending on the interest, how much interest is shown, then definitely we will bring these courses, live training, to your doorsteps. Samina Bano, ma'am, kindly guide us for MRCOG exam. I think MRCOG exams, you've had a lot, to cover, and I don't think so that I'll be able to cover that in just this session, because this is purely for the IVF, and there are lots of people who are interested in that. But certainly, I do take classes with the MedExam for the MRCOG, and we will be more than happy to discuss that. Okay. Bilal has sent that. Mariam, if I take your course, I will be able to apply for IVF license as already working here, OB&GYN specialist. Working OB&GYN where? In UAE? So if you're working in UAE and if you attend these courses, but it depends on, whether if it's depending on, which center you're applying. The Department of Health is going through its criteria, and currently they would not give IVF license just like that. They are not even taking, just some of the masters in some countries. But of course, I'm working on with them, and if you have, like, sort of say the 3 months or the 6 months online courses, certainly that will push you in a favorable position to apply for license, because they look for experience and license. And because I'm, alhamdulillah, working very closely with the DOH, and if you have a certificates and training with me, then certainly that will be beneficial with you. Lisa Fayad, no chance of KSA. Of course, as I said to you, we will be trying to bring it to other countries as well. Dr. Nida, any specific fellowship that is recognized in UAE for IVF and years of experience required to practice as IVF specialist? There is a specific fellowship for IVF, is the one I'm currently running. That is the international standard workshop, which has been approved by the Department of Health and also by the Emirati board. And of course, if UK trained like myself, I had my subspec training and fellowship for 3 years in UK. So those are also recognized. Laila Rasuli, I'm from Afghanistan. I can attend. Of course, you can attend. Afghanistan, the bilkul zamunga pukhtana khore. You can attend. I can speak Pashto to you as well. Yes, so you're more than welcome. You can attend, inshallah. Mariam, online fellowship program seems interesting. Of course, once you attend, inshallah, it will be very interactive and you will benefit hugely from it, inshallah. Can you please suggest short courses or diploma from UK which can help in seeking job in UAE as a fertility specialist? At the moment, darling, there is nothing that I can suggest because even there was one core, few like the Bristol masters that people were doing and paying literally 3,000-4,000 pounds. And UAE actually the health authority even stopped that to recognize as a for getting a job in IVF centers. So even that is not recognized as well. So I cannot unfortunately suggest any. Okay. Dr. Amna Khan suggests courses or diploma from UK. After that, we can proceed accordingly with license. Again, as I said to you, there's nothing that I can suggest. So there were few diplomas which were happening in UK. One was Bristol, which was a master's. People were doing that, and this they would apply for a license, but that is history now. So you cannot basically, that is not recognized by the UAE. As I said to you, lots of practices were happening here and people were applying for licenses, but then their practice was really, really bad in UAE, and UAE wants to be in line with any international standards. In fact, it's much, much higher than any other standards, as I must tell you. UAE training, and this is much more advanced now. So the Bristol ones, the Wales one, and all that is not recognized anymore in UAE for a specialist license. Okay. Anam, have I missed any questions? Sorry. I'm going through the chat box. Nobody wants to talk to me. They just want to talk via the online. Musarrat, good evening, ma'am. After completing MRCOG, can we do fellowship in IVF in UK without training in UK? Good question, which is not, I don't think so that is possible. For the IVF fellowship, which is called a subspec training by the RCOG, it is very competitive. And for that, you have to be in the training program in obstetric and gynecology. So once you reach the year 4 training, after you complete the MRCOG2, you you apply to the different subspecialist training or fellowship program to IVF centers, and then you are selected based on your CV, your credentials, and also your interview selection process. But if you have not trained and you haven't got the training number in UK, you cannot directly apply to for IVF training in UK. So I hope that answers your question. Anam, any more questions? Come on, talk to me, please. I'm not that frightening.
Yeah, I cannot see any more questions in the chat box, but definitely I think so that people are shy and they are not opening up their mics. So, as Dr. Yasmeen told that, it's okay to turn on the mic and ask. And
This is
again, that
just a chat. See, I'm
yeah,
sitting casually in my lounge and I'm talking to you. Honestly, I have
exactly.
I'm here to talk to you as a friend, as a colleague, as a mentor. Please don't be shy. Okay? No question, I say no question is a stupid question. Every question is very pertinent. And as I said to you, I struggled for 10 years, 10 years. And after that, hello. Hello. I'm really sorry it got disconnected. I think they don't want to talk to me, so got disconnected.
Now there are a lot of chats in the chat box. I can read it out for you. I thought, okay. So somebody has just written there, still the aura of examiner is there. Oh, when
Yeah,
you
so I
said
said to
that,
you, no, no, I'm not an examiner anymore now for you
yeah,
to, okay? There's no
okay.
I'm not examining you. I'm here to help you.
I will
Uh,
just read out another comment for you. It says, I just want to say, ma'am, you're a beautiful person, mashallah. So,
oh, thank you very much. Thank you, darling. I'm here to help you, okay?
one more query. Ma'am, can you please tell the pathway to apply an REI fellowship anywhere?
There's one question, how to become IVF specialist in Pakistan? Is there any degree after
Yeah.
MCPS? Or no, listen, darling, I'm not aware in Pakistan that there is any robust training, although, there may be, I think, experience, but there is no such criteria in Pakistan, as far as I know. So, if you have MRCOG and, FCPS and you have experience, and the big thing is that if you have connections and Vasta, I call it, for me, Vasta doesn't work. Okay. For me, the only thing work is your dedication, your hard work, and your thirst to learn. That's for me count. For me, Vasta doesn't count. But in Pakistan, and that is still the case. But no degree. I don't think so that any degrees are there. Most of those who are practicing an IVF, I don't think so. They have any specific degrees. Hina Ashik, I'm from Pakistan, did FCPS in OBS&GYN. How can I help anywhere for REI fellowship? Unfortunately, the only REI fellowship here is in UAE, that is I'm doing. The other one is in ESHRA, European Society of Human Reproduction, which in Europe. Again, for that you have to have the different criterias. In UK, I've already explained what criteria is you have to fulfill. Asma, your way of talking amazing, and I don't listen if I get bored, but I'm listening you happily. Thank you very much, darling. Love you. Thank you. Hina Ashik, there's no proper training for REI in Pakistan, so I want to do fellowship in REI, but how can't find way up till now. So this is what I explained, Hina, that I at the moment I'm trying that if I can, depending on the demand, if there is a demand, then I can set up an online partly on site, partly hybrid type of program where I will give you the whole training, the theory training online, and then we can do something that you come and spend, say, a week, 10 days, 2 weeks, depending on your availability, that I can help you with hands-on training. That is what I'm working with MedExam to create as well, so that people like yourself so many questions today. They're asking the same thing, so that I can help you guys, that you have online training and then, come and on site, because everybody's busy. They have families, they have jobs, they have, commitments, and you cannot leave those and come and spend, time for, months in a center to be trained. Of course, if you have a job. So this is what I'm trying to help, because I'm very aware of this, and there's not many places that you can get a proper, robust IVF fellowship training. Uh, uh, Yes, yes, of course. It's difficult in Pakistan. There are Mariam said, there are Australian concept and fertility centers where there is IVF specialists too. Australian concept, I know, because the concept people, the Australian who belong, I know them very well, and actually they had approached me in Karachi to come and do some training. And in fact, I had come and done a workshop there. This was a few years back, but at the moment, I'm not aware if they are providing any robust training similar to the one we are providing here. So I cannot comment on that further. But certainly, if in your country, if anybody is interested, they want to collaborate with me, I will be more than happy to set up a collaborative training program, so that it benefits you in your respective country and with me as well. So I am collaborating a lot with working to collaborate with Saudi, with Riyadh, and also with UK, so that I give you the maximum benefit. Also, I forgot to mention that we are working on getting recognition with the Canadian Royal College as well. So the candidates that currently who are doing fellowship, when they qualify after 2.5 years or 3 years, they will get a certificate both with Department of Health UAE, Fakih Center, and also Canadian Royal College. So that is what's my aim, that I will use, inshallah, for these other courses as well. Hina, it will be a huge breakthrough. Yes, that ultimately we are forced to do small diplomas, which I at least don't want to do. Yes, of course. I have seen, and I have seen so many. If you go online, you click online, and there are so many diplomas. And to be honest, those courses or diplomas which are run by people, they are not even working in IVF centers. They have not much experience in IVF center, but it's all unfortunately money-making gimmicks. And those diplomas or all that is of no use anywhere. I feel like it's badge collection. So we want to avoid that. And if we are giving you something, we will give it that it's of benefit for you guys, to help you with your with the careers, but on top of that, to help you with your knowledge. That is really important, that if you're treating a patient, you treat them with utmost honesty, and with the recent advances. So the reason, I forgot to mention the reason why I decided to provide this training in this country was because when I came from UK, I saw so many complications happening with these patients, and also so much treatment was given to these patients which was not required, and was not right. So I thought that, it shows that people does not have a proper training, and we need to give best to our patients, because as a doctor we sign do no harm, give your best, and that's on that principle I work. That ultimately these patients are very vulnerable. They are dependent on us, so we have to provide them the best of our experience, and to the best of our capabilities. How to collaborate with you, ma'am? Of course, you can, depending on what collaboration you want, you can come through MedExam. Anam is there and their representatives are there. So, of course, they will get you in touch with me and look forward to collaborating with you. How can we follow on more details for this hybrid sort of workshop? Of course, excuse me, Anam will be able to help you and the other staff will be able to help you because we are working on a lot producing these hybrid courses. I want to become IVF specialist but can't come to UK. Is there any other pathway? Of course, as I said to UK, you don't have to come to UK. You can come to UAE to have the IVF. So, it's not necessary that in UK. It's UAE you can do. You can work on these online courses. You can come and work, do observership with me. You can apply through that. Every day I'm getting so many requests and I'm trying to accommodate as many as I can. Excuse me. Okay. Uh, so Anam, can you share the online resources or contact number? How to apply for observership? Anam, my these they will
Yes.
let
Dr.
me.
Yasmin, we will be dropping the number in the chat box right now,
Okay.
and
Yeah.
yeah, all the doctors can connect there, and we will be guiding them. All right. So we are just
Okay.
dropping the number in the chat. Team
Okay.
is dropping the number. If anybody wants to speak to me, I'm available. I'll just convey it to Dr. Yasmin. You can do that. We are just sharing the number. We'll be available.
And Anam, also my team, my coordinator from Fakih, I will give you
Mhm.
her details as well later on, so you can share that as well to apply
Absolutely.
for observership. But if you guys can come through MedExam, they are coordinating with my team in UAE, and they will do that. Again, thank you very much, Maria, for your comments. Thank you. And Shahid Ashraf, what is the criteria to work in IVF in UAE? Criteria is, as I said to you earlier on, if you have experience, you have the Department of Health criteria for applying as an on their system. So if you go on the Department of Health and the licensing and the IVF, it will give you all that because the first criteria is that your university should be recognized by the UAE government to for you to apply in UAE, and then after that, you have to have an obs and gynae, degrees, depending on how many years you have done in IVF center, what exams you have completed, and once you fulfill that, then you will be shortlisted, and then you will be examined by someone like myself online. And once you pass that, then the license is issued to you. In UK, no job. So how to get experience in obs and gynae? I just did PLAB and MRCOG. Again, yes, that is a challenge, but currently they have their own candidates, so many that they are not giving basically any observership in UK to get the experience. But it's a matter of keep trying and on their system. XYZ, would I need to become an embryologist? It depends. If you are pursuing your embryology career, again, we are also running an embryology courses. So if you want to become an embryologist, then you can also attend some of these courses. And for the embryologist, the criteria for getting into IVF center is different than from a clinician. Uh, Fiza, even not able to find gynae observership. Yes, that is again, I think you have to apply to the bigger hospitals if they, I'm not aware of any OB/GYN that they provide observership in UAE. Uh, Again, how will receive CME? So of course, our programs, whatever I'm doing, it's all CME accredited. In fact, in my fellowship training every week, I do dietetics, which is CME accredited, and any these weekend courses or 6 months or 3 months, whatever we do, the weekend courses will be CME accredited. That's definite. Okay, courses details. Uh, Ma'am, from where you did fellowship? I did it from UK. In UK, it's called subspecialist training, and that's through the Royal College of Obstetrician Gynecologists, London. So in here, we UK, I did my MRCOG, and then I did 1 year research, which was lab-based research. And after that, I did my fellowship or subspec training in Liverpool, which was a 3 year fellowship. And I must tell you, I'm very proud to say that I was the only female, Asian female who was triple accredited. That means I was accredited with MRCOG, I was accredited with a reproductive medicine, and I was also accredited as an andrologist. I was the only female, Asian female, who was the only one in UK to have done andrology. But after 10 years of suffering, okay? But I'm glad. It's a there I drustad. Allah had written this for me, and that's why I suffered that. But I'm really glad because I raised three beautiful children who are also, mashallah, doctors now. And because Allah had written for me to complete my family and to put them in their careers and then pursue the career. So here I am to help my other children, all you guys, to pursue this career. Okay? Thank you. Uh, Ma'am, can we have a video tour of Fakih IVF Center? Yes, once we start, inshallah, we can give you. We've got a huge center, at the Abu Dhabi, where I'm the medical director. We are on the average doing about 300 to 350 IVF cycles per month. And in just the region of Abu Dhabi, we are doing about 10,000 IVF cycles in all our 4 centers. So yes, inshallah, once we start, we can do that. Yes, thank you. Course. Suffering followed by fruits. I love that. Yes, I always say, if there's failure, it's always there's Allah has written something for you. And let me tell you again, when I do any talks or international presentations, I always tell them that, when I was doing PLAB, I failed 7 times in PLAB, 7 times, and I passed on the 8th time. It's not that I was a bad candidate or I was poor in my studies. I was clearing it, but I would literally fail by literally 1 mark or 2 marks because Allah had written something for me 10 years later. If I had passed PLAB in, say, 99, in the 92, 93 at the time, I would have ended up somewhere very, basic. But Allah had written for me something now, what I've achieved, alhamdulillah, alhamdulillah, that Allah had written this for me. That's why I was seeing the failures. At that time, you don't see. So I have a very strong belief that if you have failures now, this is not the right time for you. Allah has written for you something in future, maybe months later, years later, 10 years later. Do not get disheartened. Do not give it up. Keep on fighting. Keep on struggling. Okay, and if Allah has written for you, you will get it. My example is the live examples in front of you. Okay. Uh, uh, Ma'am, how to meet with you? Of course, you come to UAE anytime, and I'll be more than happy to see you. Or if I come to Pakistan, you med exams will announce whenever we are coming. You're more than welcome to come and meet me. Okay. Is it active in Doha, ma'am? What is active in Doha? IVF Center? Yes, IVF Center is there, but the training is only in Abu Dhabi. And I've got a few huge faculty here. So the fellowship program you cannot run on your own. You have to have a team, and I've got a fantastic team of faculty from internationally trained. They are from America, from UK, Europe, and they make part of my team in training. And all these the online courses that we do, my faculty will be involved in it. And also we have a huge embryologist team and andrologist team. That's how we run. Single-handed, we cannot do anything. It's always a good team that we work with. I'm leaving. I have two patients in LR. It was amazing sessions with you, Doctor. Lots of love. Thank you very much, Dr. Amna. Love you too, and good luck. Here, some centers are offering stem cell therapy for poor ovarian reserve. What's your opinion? Absolutely. Okay, so that's sort of what I'm gonna tell you. This is actually I have devised a randomized controlled trial that we are starting. It's on the use of exosomes that we are giving to patients on poor ovarian reserve. So we do not give, as I said to you, I do not believe in mumbo jumbo. I always do things in a proper scientific way and properly controlled. So the Department of Health approved our trial now for the use of exosomes. So exosomes, these are small RNA particles that helps with the development of the rejuvenation of ovaries. And we will be randomizing patients for the use of these exosomes and injecting exosomes in their ovaries. And then we will be assessing their hormones and AMH levels. So stem cell, yes, we do not offer it just like that, but we want to prove it that whether it works or it doesn't. So our trial, which is going to be starting in the next couple of weeks, that will prove that whether it works or not. But we just do not offer it just like that. I have become your friend. You have ability to make people like you. Thank you very much, Asma. Thank you. That's I'm here. If I can be of benefit to anyone, I'll be more than happy. Okay. Ma'am, can you do fellowship in China? Do you have any idea? Oh, China, you have anyone who wants to collaborate with me? I would love to take this training to China. In fact, with one party, I think they are approaching us, but that is with some research. But definitely, I would love to come to China. Okay. Uh, Thank you. Workshop details. Kindly share all courses through some sources, preferably med exam, which are offered by Fakih, so we can join. But waiting for that hybrid fellowship. Inshallah, yes, definitely we will get that hybrid course set. That's the reason why we did this sessions, and we'll do another one, inshallah, because we want to know what you guys want. You give us, you tell us what is easy for you, and then my job is to create the best possible course for you guys, which is helpful, because it's a lot of time, lot of effort, lot of money, and we do not want to waste anybody's time and anybody's money just like that. So I want to make sure that we give you the best possible your workshop or training. Okay. Where I am. Yes, I also want to do some short courses to improve my CV just at the start of my career. Yeah, that this will be wonderful for you. And also we are planning to do some interview courses, inshallah, sessions as well. send me recorded video of this talk so that I may share my colleagues too. Of course, you can. So the team will say, okay. I think the internet doesn't like me to talk too much. Anam? Hello?
Yeah, it seems like you are loaded with information and it needs to stop you. Yeah. But
Okay.
yeah, it was such a great session. I guess that the queries that people have asked, they were very new, and I guess that other people they have gained a lot of knowledge by listening to all the answers and replies you have already given. And still, I
Yeah.
think so that there are a lot of queries. So
Anything else? Anything else? Or they said no audio, no video. Okay. Asma said, Hina, we want proper REI fellowship, ma'am. So once trained properly, we can work and train other. Absolutely, Hina. That is what my aim is. I want people to get trained properly, not just like, as I said, mumbo jumbo. But you need to train properly, and then so that you can train the future generations. Now I will retire, okay, maybe in a couple of years' time, but I want to pass my legacy to someone else so that they can benefit from it and they can help their patients. Okay. Okay. Anything else? What time is in Pakistan? Three, four,
yeah,
five.
it's 8:21 in Pakistan.
8:21 is still. So you guys had your dinner? I've not
Yeah,
had any coffee or lunch. I'd
yeah,
love to
it's
talk to
dinner
you
time
all.
here. Yeah. So still, we would like to request that if anybody has any query, which was, maybe not attended because it was queries were flowing like anything in the chat box. So you can write to the team and we will definitely get reply for you from Dr. Yasmeen later on after the session end. Okay. So yeah, your recording will be provided, Dr. Fiza, to anyone who missed out. So don't worry about that. We will be doing it. It will be also available on our Facebook page. We mainstreamed it there as well. So yeah, we will provide all the links, all the complete session will be there.
So do you guys need, just sort of ideas what they want? They want to have, more sessions or you know, whatever they want. I think we can work on with the team, with the med exam team, and create whatever is best for you. So yes, the contact details we'll share with you. Anam, remind me, I will share you the email that they can send for observership.
Absolutely, I'll do that.
What is the future after doing courses with you? The future is that you can, apply for jobs. And if you have done, proper courses and all that, you, as I said to you, if you're interviewed, you will get a bit of edge. So, for example, if 10 candidates have come to me for IVF job for one post or two positions, and out of those 10, one or two have done IVF training or IVF courses from a reputable company, from with a reputable person, of course I will give them a bit more marks compared to the other. That's what happens in any organization. So even if you are highly qualified and you do not have IVF experience compared to someone who has IVF experience but less qualified, of course the job will be given to someone who has got some experience in that particular field. Online courses of few days doesn't help, I heard. So this is what I said. It is Salochina Himanani. If you, what we are doing is that we will be doing initially the exposure is like a weekend course. You will get exposure to what to expect. You will see the faculty and you will learn, how we are approaching you guys and teaching you. And then we are devising some online courses plus on site. So you will do online and on site. I cannot teach you IVF, everything hands on online. The limitations are there. But it's up to you how much you benefit from this. So once you have the theory side, then you can put that theory to the practicals in your own respective country or whatever. Of course, you want to be fully fledged trained, then of course you have to apply, the 2 years program or the 3-year program. But for that, then you have to leave your jobs and be full-time doing the fellowship program. So in the beginning, I said that that's not possible for everybody. Yes, when the fellows that we are employing, we pay them some salary, but that's not much because we are giving them training. And this is not free. Of course, nothing is free in this world, but we are trying our best to give you the best training. Now, those, for example, if you are in say Pakistan and you have a regular job, you cannot leave that job because your family depends on you, and you cannot leave that job and come and work in UAE and get trained. If you don't have any problem with the finances, yes, you can do that. But majority of the people don't have that luxury. So for those people, we are providing a hybrid type where you can come do some online and some do on site, and the rest will be, you continue to practice in your own country. Online liaison for variety of infertility patients might help to improve practice without leaving job. Absolutely. That is the whole idea, that we will be going through different scenarios, and those online courses are helping you. You can bring your queries. Like, for example, somebody asked me about the stem cell in poor ovarian reserve. So these type of different scenarios you'll be able to discuss. Of course, I cannot teach you full IVF and make you an expert by within 2 days or within 3 months. It took me 3 years to get full training in IVF. And of course, I would not expect anybody to achieve that expertise in 3 days. Uh, Inshallah, hybrid, definitely, inshallah. That is what we will do. Okay. Anything else? I'm here for another 5-10 minutes. So please, if you have any queries, we'll be more than happy. Otherwise, then we can call it a day. What do you think, Anna? Okay, so after MBBS, Maria asked, after MBBS, how you can pursue career in IVF. After MBBS, you have to have the OBS&GYN training. IVF, you cannot just join after completing your MBBS. For IVF, you need to have the OBS&GYN training, and I would expect the candidate to have at least, 4 years or 5 years of OBS&GYN training before you go IVF, because IVF is a subspecialty of obstetric and gynecology. So if you do not have the obs and gynae training, you cannot come IVF unless and until you want to pursue it as an embryologist. So after MBBS, you can do a master in embryology and then you can get training in embryologies, but not as a IVF doctor, but as an embryologist. And then there's opportunity for doing PhDs. So currently, I'm also supervising two embryologists to do their PhD. One is doing with the Indian university, and the other one will be doing with the UK university. So for the embryologists, we are also providing what is it called, embryology training and PhD. How can we retrieve RNA for stem cell therapy? So for stem cell therapy, there are mesenchymal, stem cell, and also from the placenta, and also the autologous from the patient's own fat. So we will be doing trials on both of that. So that's what the stem cell, and also there are companies who are actually selling the exosomes or the stem cell, which is our part of our trial. Hmm. Okay. Infertility specialists and IVF specialists are same or separate courses? No, 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 it's the same. IVF, infertility, actually, in IVF, the first part is infertility. That is, we teach you the basics of, ovulation induction, which general gynecologists can use in their clinic. So the ovulation inductions, the IUI, and then you go through IVF and andrology. So it's basically it's a combination of both. Okay, anything else, Anna?
Dr. Yasmeen, I guess that's it. We have spread the link as well in the chat, and still, if anyone has the query, they can just text us back to those number and the link, and we will be providing them help. And definitely, if somebody would like to connect to you, I'll be just sharing their contact through your team. So I guess.
Okay, somebody XYZ said IVF lab needs a lot of expensive equipment, which might not be possible for a single individual to set up. Uh, I never said that as an embryologist, you should be setting up your IVF lab. IVF lab is part and parcel of an IVF center, and this is run by embryologists. And there are certain specific criteria in every country that the IVF lab is based on. So when you become an embryologist, you are employed by the IVF by the embryologist team to employ. But if you do not have the experience of being an embryologist, you can not work in an IVF. Okay, all right. If no experience in obs and gynae, anything for beginners who are not in any training. If just MBBS MRC part 1, but no experience. Yes, so you can still attend these courses, Fiza, if you have no experience, so you can attend. And these will be actually a taster sessions for you, that once you get the obs and gynae, whether this interests you or not, because people, when they start an obs and gynae, they are not sure which specialty they're going to pursue, because obs and gynae has got multiple subspecialties. Nowadays, they do either they go in scanning, they go in minimal access, they go in endometriosis, they go urogynecologist, oncology, IVF, and all that. So these sessions that you attend or courses you attend, it will give you an idea of whether this is something for you or not. Okay. What are levels of IVF training? Uh, what do you mean by IVF training? Levels. So levels is that IVF training is after you finish your 4 or 5 of residency of the obs and gynae, then you become IVF. So IVF is either you know IVF or you don't IVF. There are no levels. We want a properly trained IVF people in our center. I would not let anybody coming who does not have a proper IVF training. So it's not level 1, level 2, level 3. Yes, in fellowship program, these are called first year fellows, second year, and third year. And the training that we built is the way we train them is we train them first initially in basics, okay? We teach them the embryology, physiology, anatomy, and all that. Then secondly, they go on to the clinical, and in the clinical, they start the hands-on training as well, and there are certain modules and numbers that they have to achieve, plus they have to do the research, and then they become year 3, which we train them in the management and other advanced thing, and that is the different learning. But duration of these courses is it could be 3 months, 6 months, and that sort of will give you the initial sort of training for IVF. The duration, of course, will be, yes, the hybrid, we will be doing 3 to 6 months, but we have not decided. Once, after your feedback, then we can do that. Oh, okay. Okay. Okay, thank you very much. And thank you everybody for joining. And I'm really sorry that I was delayed by about 10-15 minutes, but I think we caught up. It's just like, when the flight gets delayed, the pilots pick up. So that's why I picked up in the end. But I'm here to help you. And please feel free to contact the MedExam team for any queries. And inshallah, look forward to seeing you all in our first online course, which is, I think, Anam, 31st January to 1st
Yes,
February.
exactly.
Correct. Yes.
21st January
And
and 1st Feb. Yeah.
yeah, so you will, inshallah, see me there, and we will have interactive sessions, and also my faculty will give you all the knowledge. So the way that we have devised program is from basic to advanced, plus there will be interactive sessions. There will be cases that we will be discussing, challenging cases, which will help you in your normal practice as well. Okay. Good. God bless you all. Have a lovely evening, night, wherever you are, and look forward to seeing you. Bye-bye.
Thank you so much, Dr. Yasmeen and everyone. Bye, Dr. Yasmeen. Have a nice night ahead. Take
Thank you.
care.
I've got a flight tomorrow. I'm flying back to UAE tomorrow. That's why I thought, we'll do this tomorrow. But we'll see you, inshallah, next time. Take care. Bye-bye.